I want to go back a little bit now to our ability to perceive such things, and I'm going to speak again about the human's capacity to pattern recognize, and
Okay.
that I've never had a scenario where we teach palpation at one of our courses, and then someone automatically they feel things incredibly better than they did previously. Going back to the meditation thing, just because I explained to you the benefits of meditation, it doesn't mean that you get to claim the actual benefits of meditation just because you thought about it. It actually takes practice. So
Hmm.
we've never said that we can improve your ability to perceive these changes, but now that we understand what we're supposed to be perceiving and why, and we understand the first principles of how, with regards to how our receptors function, what we're saying is when you combine this information and you mindfully practice as a therapist, as we do, whereby on a daily basis, we're not only palpating and interpreting what we're feeling that are normal things, but we're also finding problems in tissue and associating pain with findings, or we're associating conditions that we find with palpatory changes. Our ability to pattern locate and to start to interpret what we're feeling based on our pattern recognition is what then takes a relatively okay therapist and makes them a sensational therapist. Similarly, when you go, it's very hard for people to deny that when you go to one therapist versus another, their touch feels different. And the experienced people that we've talked to and dealt with many of the greatest researchers on the planet on this regard. We've taught palpation at university settings, at college settings for 20 years now. You can tell when someone has been paying attention. You can tell when someone has mindfully trained their haptic touch. Just like you can tell when someone mindfully trains to be a musician. Like it's very easy to look at fine motor skills in a musician, which, by the way, literature has demonstrated increased finger pad sensitivity in musicians and in surgeons. For whatever
How
reason, we don't want to extrapolate that to manual therapists, but maybe it's
about people that read Braille,
how the
right?
people that
Same thing.
read Braille. There's another good example. I mean, talk
Yeah.
about our ability to pattern recognize. And if you want to, talking about the baby in the bathwater, if you want to take all of this information and say, you know what, based on the few studies that have actually really looked at therapeutic palpation, there's some on motion palpation of vertebral segments and how
People say,
there's
yeah.
not a lot of good interrelator reliability between our ability to feel, but there's good reasons for that as well. I mean, motion segments move in millimeters, not in inches, uh,
Right.
whereas tissues to large extents slide past or wiggle past one another to greater lengths. So even conceivably, the idea that we can't palpate, I mean, I can say the same thing about our sutures. I'm sure that there's some give in a baby's suture, but our ability to feel that, like, it's small, just like our ability to feel, T5 moving on T3 in rotation. I don't think that that's
Or the SI joint, for
or the
example,
SI joint that has what, 3 millimeters of motion at best, at
three,
best in
four
a baby.
millimeters.
So that's a poor way to throw the baby out with the bathwater, to look at that kind of research and go, oh, you see, no need to palpate because we can't do that. But I think, like every other problem, there's nuances to this,
Of
and it's
course.
it's very easy to strawman arguments, especially maybe by people who haven't paid attention to palpation, as you said. If we've put in a good 20, 25 years of mindfully doing this. So it's like we might have a skill. Maybe we're playing guitar and other people are just learning their chords. And maybe there's a difference there, which is difficult to perceive. But based on the research that we've laid out, I think it should at least interest you that perhaps there's a there. There's something there, considering all of our knowledge about touch and how it benefits pain and anxiety. And forget, we talked about how it doesn't, we talked about pain a little bit and how we don't touch pain, but there's a lot of research about post-surgical clients, clients that have cancer, for example, and how touch decreases pain levels significantly, decreases anxiety, decreases time to return to function. I mean, there's just
Decreases cortisol. Increases parasympathetic, the parasympathetic
there's
system.
immune benefit, immunobenefits to touch. I mean, there's so much there. There's so much there. And then if you tag that along with our ability to improve our sensory processing, and you tag that along with all of the machinery that we've discussed that we have in our hands, and the sensitivity of that machinery. Like we're talking about we're talking about sensitivity to the extent that people can learn Braille and people can pattern recognize. It just seems to me like people should be erring on the side of this is an important skill that I should have as a manual therapist. And I'm going to argue now as a trainer. And I don't want to bogart the conversation. I'll pass it on to you. But another thing that we've realized is at one point we were only teaching palpation to our manual therapy students. And then we opened it up to anyone taking any of our courses in mobility training and strength training, the ISM, the FRC. And what we found is that the benefits of of palpation training to trainers. I mean, it's the benefit is insofar as you can be as specific as you want or as general as what you want with your training. And general inputs lead to generalized results, and specific inputs lead to specific results. Now, we don't teach our trainers to become therapists, but the ability to just identify anatomy, understand the three-dimensional framework of the anatomy. Maybe they're not going to be palpating um, for tissue damage per se, but their ability to localize tissue, their understanding of anatomy and how it relates to other layers of anatomy and how the movement between layers occurs, and being able to feel that movement and to feel how things achieve length. Trainers stretch people all the time, but never along that time did we ever teach them to put their hands on what they're stretching as they're stretching, just to see if they can, subjectively get information that they can then utilize, um, not necessarily with regards to therapeutic intervention, but with regards to exercise intervention. It's immensely positive for trainers to also experience this kind of learning.